My name is Patel, and today I'm presenting my abstract titled The Student Dermatology Clinic for the Underserved, also known as SDU, a service learning model for dermatology residents and medical students in southwestern Pennsylvania. Uninsured and underserved communities face several barriers to accessing dermatologic care. Patients with low income seeking dermatologic care face longer wait times and higher rejection rates than patients with private insurance. This underscores the need to expand access to dermatology providers amongst marginalized populations, as these gaps in healthcare can have negative impacts on dermatologic health outcomes. Free clinics can be an instrumental resource in these marginalized communities by strengthening the local healthcare infrastructure and helping to bridge the gap in access to care. In southwestern Pennsylvania, the Student Dermatology Clinic for the Underserved is a free dermatology clinic for patients at Squirrel Hill Health Center. The objective of this study was to describe and evaluate the Student Dermatology Clinic for the Underserved as a sustainable service learning model in order to increase outreach and offer culturally rich and medically challenging learning experiences for all trainees and medical students. To provide some background on the SDU Clinic, SDU functions as a partnership between dermatology residents and attending physicians from the University of Pittsburgh Medical Center, UPMC Department of Dermatology, medical students from the University of Pittsburgh School of Medicine Dermatology Interest Group, and the Squirrel Hill Health Center, a federally funded community health center. The Student Dermatology Clinic for the Underserved hosts 4 to 6 clinics annually with approximately 8 to 15 patients seen per clinic. Patients are referred to SDU by primary care providers at the Squirrel Hill Health Center. Medical students from the Dermatology Interest Group at Pitt coordinate student volunteers and patient scheduling, while UPMC dermatology residents coordinate resident participation. The UPMC Department of Dermatology provides all necessary supplies, including biopsy kits, and biopsies are read by the UPMC Dermatopathology Unit at no cost. Patients are first seen by a team of medical students who present the history and physical exam findings to a dermatology resident. The medical student and resident team then evaluate the patient together, which provides residents the opportunity to teach dermatology to the med students and provide feedback regarding their clinical reasoning skills. The dermatology attending physician also precepts the medical student and resident team as they devise patient care plans along with providing patient education. To ensure that follow-up care is arranged, UPMC dermatology providers communicate directly with the Squirrel Hill Health Center providers. To evaluate our free clinic as a service learning model, we distributed a survey to all UPMC dermatology residents. Of those who had volunteered at SDU Clinic, 88%, which was a total of 8 residents, report that their involvement with SDU increased their awareness of health disparities and social factors impacting dermatologic care, and 88% report that their involvement encouraged them to be more involved in community service throughout their careers. Participation in SDU was also deemed a high-yield learning opportunity by 88% of participants. Some of the challenges associated with implementing our free dermatology clinic included scheduling conflicts, as the SDU clinic occurs on Tuesday evenings, which may limit patient participation. Since the patient population of SDU is both culturally and ethnically diverse, we utilize telephone and video translation services to communicate with non-English speakers. During the COVID-19 pandemic, which resulted in patient care restrictions, the providers at Squirrel Hill Health Center have discussed and coordinated patient care with the dermatology faculty at UPMC. Overall, we have identified SDU as an effective service learning model that facilitates vertical learning and interprofessional collaboration amongst trainees. By partnering with a local community health center, we were able to provide patient-centered longitudinal care while reducing barriers to access in underserved populations. In this service learning model for residency training programs, we not only address the dermatologic needs of marginalized populations, but we also create a rewarding training environment for medical students and residents that fosters an interest in health disparities, increases skin health equity, and cultivates cultural sensitivity.